This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. I'm Dave Wilson. Joining us this morning, a new member of the Mon Health team, Dr. Emmanuel Mejias LaFontaine. I hope I got that at least pretty close. General surgeon with Mon Health and new to the team. Good morning, doctor.
Good morning. How's everyone? Hopefully everyone's had a great weekend. Thanks for having me here.
I'm glad you came on. Did I get your name? Did I get it pretty close at least?
Very close, yeah. Emmanuel Mejias LaFontaine.
Mejias. Yep. All right. It was the middle part there that was throwing me off just a little bit.
But it's okay.
Glad to have you on this morning. And as I mentioned, new to the Mon Health team, so we'll get to know you a little bit today. And we'll talk about general surgery at Mon Health as well. So just to start off, we do this with everybody. You have to talk about yourself just a little bit. Give us a quick background about where you're from, where you went to school, and got your training.
Sure. So I'm originally from Puerto Rico. I was born and raised there. I lived there all my life. Basically, I did medical school there. I did my general surgery residency in Puerto Rico as well. I'm the first doctor in my family, and I think that's pretty much it for education-wise.
How did you? How did you go from Puerto Rico to ending up here in Morgantown then?
So during my last year of general surgery residency, I was looking for job positions, right? And 2 years ago, I was searching specifically here for Morgantown because my fiance is here doing radiology. And so I wanted to come here, right? At that point, almost 2 years ago, when I was searching for the job, there were no open positions basically for a general surgeon. So I noticed that back in Puerto Rico, there were a lot of we had a need of minimal invasive surgery there back home. So I just said, why not do an extra year of training in which can help it can help just cover that deficiency back home in Puerto Rico, and then it gives me another year just to see if I find a position here in Morgantown, right? So I was lucky to find a position of extra training in minimal invasive surgery in Oakland, California. And after that year went by, all of a sudden there were a couple of options here in Morgantown to work as a surgeon. So I think that worked out fine for me. I was lucky, very lucky for that.
So how long have you been here in Morgantown now?
Yes, I've been here like 2 to 3 months right now.
And how's Morgantown treating you so far?
Oh, it's been great. I think Morgantown it's a beautiful city. It's very quiet, beautiful, and everyone has been at least in the hospital, everyone has been very available to me. They are always around asking how they can help me. And basically, I feel like being home. I haven't had that stress of like starting in a new place and feeling lost all over. So I'm very thankful for all the staff there.
Well, you say you're the first doctor in your family, the first to go into this field. So what drew you to the medical profession and ultimately influenced your decision to become a surgeon?
I think it was a slow process. Growing up, I remember my parents, and we would grow up in the church and helping everyone around, people with low income, people with diseases, and I did that while growing up. And I always was there for my grandparents to help them in minor stuff, just taking them to medical appointments, helping them at home. And then all that helping people really gratified me. I felt happy as a person. I liked to do that. So later on in college, I took a couple of science courses, anatomy, and other courses that basically I made the decision of becoming a surgeon. But that was the only specialty I was looking forward to, just because of using my hands and the anatomy involved. I just loved that. So that's why I went into medicine and then surgery.
Our guest this morning is Dr. Emmanuel Mejias LaFontaine. He's a general surgeon new to the Mon Health team. We'll continue our conversation. Got to squeeze in a quick break right after this, or we're going to squeeze in the quick break right now. We'll continue the conversation right after this. You're listening to Mon Health Talk this morning on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Continuing our conversation with Dr. Emmanuel Mejias LaFontaine. He is a general surgeon new to the Mon Health team, joining us on Mon Health Talk this morning. And doctor, what services do you offer at Mon Health?
So in Mon Health, basically we're covering, at least I will be doing breast surgery, placement of ports for chemotherapies. We'll be doing soft tissue surgeries, meaning small masses in the skin, lumps and bumps, how we call it. We'll do gallbladder surgery. We'll do gastric surgery. We'll do hiatal hernia surgeries. We'll be doing upper endoscopies, colonoscopies, colorectal surgery, and hemorrhoidal surgery as well. I think that pretty much covers the big umbrella of surgeries we'll be doing there. Yep.
And certainly each patient is their each individual case, but a lot of the procedures and surgeries you just mentioned there, minimally invasive procedures are now available. And we talk about this very often on this show, that it's not a lot of times surgeries don't require several days in the hospital anymore. You can come in the morning and possibly go home in the afternoon.
You're correct. So minimal invasive surgery has been out there for a while now, 20, 25 years, and it has many benefits for the surgeon and, more importantly, for the patient as well. And like you mentioned, it's a faster recovery, less pain. Patients go home earlier. And nowadays, we have added the robotic system, the Da Vinci robot, which makes even an easier surgery for surgeons. So this translates to better results. And I think that's the newest thing around, even though it's been 5-10 years out there. But we have it here in Mon Health, and I would say almost 80% of surgeons are using it. And I think that's something for the future right now in the minimal invasive surgery area.
When you are meeting with patients prior to their surgery, what are some of the common questions they have for you, or even some of the common misconceptions they have about some of these procedures?
Well, it's funny when I see patients and I talk to them about the minimal invasive surgery that will be using the robot. Some patients get scared and they ask me if the robot's going to operate and how does that work. Then I orient them that if the robot, it's a tool, but that we control everything that happens with the robot. Like basically we just place those instruments in the patient's body, but at the end we do everything. The surgeon controls everything that happens with the robot. I think that's a very common question. And then the other concern I see around it's pain management. And I've seen patients, I think every patient has different pain threshold. I've seen patients that after this minimal invasive surgery, next day they are without pain. But I have other patients that they tell me, yeah, I had some minor discomfort for 5 days, but then I went back to work after a week. So it's at some point it's very patient dependent.
How common is it? Go ahead.
Sorry, I interrupted you. Go ahead.
No, what I was going to ask is how common is it for a patient to maybe be apprehensive about a surgery or a procedure prior to it, but then afterward, when you see them in those follow-up appointments, their quality of life is better. Maybe if they were suffering pain, that has gone away because of the procedure, and they're now thanking you or happy because their life is better. How is that more often than not the case?
Yes, I think that's 90% of cases. Patients are very pleased with the surgery they had, and it's very important to be very clear when you see the patients before the surgery and try to explain to them what are our goals after the surgery, what should happen, and I also like to talk about all the possible complications a procedure might have. But like you said, it's very common to see them smiling at you in that follow-up visit. And that's our purpose here.
Yeah, is that the most gratifying part of the job is when you perform that procedure and then the patient's life is better because of it afterward?
Yeah, that truly is the most satisfying part. We have simple procedures, and then we have more complex procedures. We have patients that walk into a surgery very healthy, but we have other patients that come from home very, very sick, and most of the time we get that chance of basically curing very sick patients, and you can see in their face and in the studies and laboratories next day how they improve significantly, and then you say to yourself, wow, this, like, every day you get reassurance that you're doing the right thing, and I think there's not a better feeling than that.
Our guest this morning is Dr. Emmanuel Mejias LaFontaine, general surgeon with Mon Health. We've got to take our one more break, final break of the show. We'll continue the conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning is Dr. Emmanuel Mejias LaFontaine, general surgeon with Mon Health, new to the Mon Health team. And as a general surgeon, you mentioned some of the different procedures and different services you offer. Seeing so many different patients for so many different types of procedures, doctor. So can you kind of describe what a typical week is like for you?
Sure. So let's say Mondays, I start off with the morning clinic, and there I can see 5 to 10 patients in the morning, and usually my afternoons are doing a couple of surgery, depending on the complexity of the procedure, one surgery or maybe 2 or 3. And I get to see patients with different diseases, right, including a lot of GI conditions as well, because there's a necessity of GI doctors here in the area. And but basically, yeah, I can see patients with reflux, patients with gallbladder problems, patients with hernias, patients with colorectal conditions. And I think that keeps you active, keeps you reading, and then you keep up to date in every pathology. And I think that's what I like from surgery, the diversity of diseases we get to treat.
How many surgeries will you do in a day?
Right now, I'm doing half days, so it's an average 3 surgeries. But if you have a full day of surgery, you can do, depending on the complexity, in between 3 to 6, 7 cases.
Wow. Seven surgeries in a day. I do one hour show a day, and I'm spent for the rest of the day, 7 surgeries. Hey.
And during the week, we take call as well, so that keeps you on the edge during the day because you're doing your thing, seeing patients in the clinic or operating, and you have calls from the emergency room or the floor for new consults to see, and then you may have new surgeries to add after your regular day. So, yeah, you keep yourself busy. I think that's good for me. I'm young, so.
That's right. Stay busy. Hey, you've been with Mon Health for a few months now. What has been the most enjoyable part of your time at Mon Health so far?
I think the staff around me, the other surgeons, my partners, Dr. Johnson, Byron, and Statler, they have been very welcoming to me. They are always around, making me feel at home. I like the most that even though at this young stage in my career, I keep learning every day something new. Like, we have our own surgical guidelines, we have books, but every surgeon has their own book, right? So I keep on learning from these guys that have been out there in the surgery world for years, and I basically have this opportunity to keep on learning and evolve as a surgeon, and I think that's been a very important part of my first few weeks here in Mon Health.
You know, I have interviewed a lot of physicians and surgeons and nurses since we've been doing Mon Health Talk, and time again, they will tell me one of their favorite parts, most enjoyable parts, is the team. And then be careful, because once they get you, people don't like to leave. They end up. I've talked to folks who said, "Yeah, I showed up, and then 15 years later, still here and loving it." So I hope that we get to chat many more times down the road, Doctor.
Thank you. I appreciate your time, and feel free to visit us in our website in Mon Health. And if you have any surgical concerns, please call us to the office, and we'll gladly see you and help you.
Absolutely. Again, of course, you can always get more information. Go to the website, monhealth.com/surgery. Our guest this morning, Dr. Emmanuel Mejias LaFontaine, new general surgeon at Mon Health. Doctor, appreciate the time this morning. Good talking to you, and look forward to talking to you in the future again.
Thank you. I appreciate it. Have a good day.
You as well.